is a good beginning exercise since it provides a gentle stretch to the chest and shoulder muscles. Stand or sit comfortably with your arms relaxed at your side. In a circular motion, bring your shoulders forward, up, backward, and down. Try to make the circle as large as you can and get both of your shoulders to move at the same time. If you have some tightness across your incision or chest, begin with smaller circles, but increase the size as the tightness lessens. You may find that the backward direction is a little tighter across your chest. This will get better with practice. Now, switch directions and do 10 shoulder rolls in the forward direction. Bring your shoulders backward, up, forward, and then down. Shoulder wings. Sit comfortably with your hands in your lap. Place your hands on your chest or collarbone. Raise your elbows out to the side as high as you can, but no higher than your 90-degree range of motion restriction or shoulder level. This is what the exercise looks like with the 90-degree range of motion restriction. Slowly lower your elbows. Repeat this movement 10 times. If you experience discomfort near your incision while performing this exercise, hold your position and do the deep breathing exercise. If the discomfort doesn't go away, do not raise your elbows any higher. After 10 repetitions, slowly lower your hands back down to your lap. Arm circles. If you had surgery on both breasts, do this exercise with both arms, one arm at a time. Do not do this exercise with both arms at the same time. This will put too much pressure on your chest. Stand with your feet slightly apart for balance. Raise your affected arm out to the side as high as you can, but no higher than your 90-degree angle range of motion restriction or shoulder level. This is what a 90-degree range of motion restriction looks like. Begin making slow, backward circles in the air with your arm. Be sure the movement is occurring at your shoulder and not at your elbow. Keep your elbow straight. Increase the size of the circles until they are as large as you can comfortably make them, but be sure not to raise your arm higher than 90 degrees or shoulder level. Be sure to complete at least 10 full backward circles. If you feel any aching or if your arm is tired, take a break. Continue your repetitions when you feel better. Slowly lower your arm to your side. Rest your arm for a moment. To begin the second part of the exercise, raise your affected arm out to the side as high as you can, but no higher than 90 degrees. Begin making slow forward circles. Increase the size of the circles until they are as large as you can comfortably make them, but do not raise your arm higher than 90 degrees. Be sure to complete at least 10 full forward circles. If you feel any aching, or if your arm is tired, stop before 10 circles. Lower your arm to your side. Back climb. This exercise can be performed in a sitting or standing position. Place your hands behind your back and grasp the hand on your affected side with your other hand. If you have had surgery on both breasts, use whichever arm moves most easily to assist the other. Slowly slide your hands up the center of your back as far as possible. Hold the highest position for 1 minute. If you feel pulling or stretching near your incision, stop at that position and do the deep breathing exercise. If the tightness goes away, try to slide your hands up a little further. If it's still there, do not slide your hands up further. Hold the highest position you can for about 1 minute. You should feel a gentle stretch in your shoulder area. After 1 minute, slowly lower your hands. W exercise. This exercise can be done standing, sitting, or lying on your back. Doing this exercise with your back against the wall may help you position yourself properly. Form a W with your arms out to the side and palms facing forward, with your shoulders no higher than 90 degrees. Bring your arms to the highest comfortable position. This is usually around 45 degrees. Pinch your shoulder blades together and downward, as if you were squeezing a pencil between your shoulder blades. If you feel discomfort in the area near your incision, stop at that position and do the deep breathing exercise. If the discomfort passes, try to bring your shoulder blades a little closer together. If the discomfort does not pass, stay at your current position. Hold the most comfortable position and squeeze your shoulder blades together and downward for 5 seconds. Slowly bring your arms back down to the starting position. Repeat this exercise 10 times. Begin doing the following 3 exercises only when your surgeon tells you it is safe. This is usually after your 2-week follow-up visit. 2 of the exercises will require tape to mark your progress, so have 4 pieces ready before you begin. You may also find it helpful to have a stopwatch, timer, or watch with the second hand nearby, as you will need to hold some of the exercises for a full minute. Forward wall crawls. You will need 2 pieces of tape for this exercise. Stand facing a wall. Your toes should be about 6 inches from the wall. Reach as high as you can with your unaffected arm and mark that point with a piece of tape. This will be the goal for your affected arm. If you have had surgery on both breasts, set your goal using the arm that moves most comfortably. Place both hands against the wall at a level that's comfortable. Crawl your fingers up the wall as far as possible, keeping them even with each other. Try not to look up toward your hands or arch your back. When you get to the point where you feel a good stretch, but not pain, do the deep breathing exercise. Return to the starting position by crawling your fingers back down the wall. Repeat the wall crawl 10 times. Each time you raise your hands, try to crawl a little bit higher. On the 10th crawl, use the other piece of tape to mark the highest point you reached with your affected arm. This will allow you to see your progress each time you do this exercise. As you become more flexible while doing this exercise, it may be necessary to take a step closer to the wall so you can reach a little higher. Side wall crawls. You will also need 2 pieces of tape for this exercise. Stand with your unaffected side facing the wall, about a foot away from the wall. Reach as high as you can with your unaffected arm and mark that point with a piece of tape. As with the forward wall crawl, this will be the goal for your affected arm. If you've had surgery on both breasts, set your goal using the arm that moves most comfortably. Turn your body so that your affected side is now facing the wall. Crawl your fingers up the wall as far as possible. When you get to the point where you feel a good stretch, but not pain, do the deep breathing exercise. Return to the starting position by crawling your fingers back down the wall. Repeat this exercise 10 times. You should not feel pain while doing this exercise. It is normal to feel some tightness or pulling across the side of your chest. Focus on your breathing until the tightness decreases. You should breathe normally throughout this exercise. Do not hold your breath. Also, be careful not to turn your body toward the wall while doing this exercise. Keep your body at a 90-degree angle to the wall. On your 10th crawl, use the other piece of tape to mark the highest point you reached with your affected arm. This will allow you to see your progress each time you do the exercise. Hands behind neck. Stand or sit comfortably with your feet on the floor. Clasp your hands together on your lap. Slowly raise your hands towards your head, keeping your elbows together in front of you and not out to the sides. Keep your head level. Do not bend your neck or head forward. Slide your hands over your head until you reach the back of your neck. When you get to this point, spread your elbows out to the side. Hold this position for about 1 minute. If you are not able to get into this position, reach up and stretch your elbows back as best you can. If you have some tightness across your incision or chest, hold your position and do the deep breathing exercise. If the tightness decreases, continue with the movement. If the tightness stays the same, hold the position you are most comfortable in for 1 minute. Breathe normally. Do not hold your breath as you stretch your body. Slowly come out of the stretch by bringing your elbows back in front of you and sliding your hands over your head. Then, slowly lower your arms